Talk to Joe on 1850 715 815.
And Joe at RT.ie. I should also mention that on Friday, if you are 65 this coming Friday, if it's your birthday, will you contact us on live line, please, at Joe at RT.ie. If it is your birthday this coming Friday, and if you are 65, in other words, in another world, you would have been receiving your pension, please let us know by email ASAP. Now, yesterday, again, towards the end of the programme, a very, very moving call by a young woman, well, she's just turning 20, Paula. And Paula was on the programme talking about anorexia, and she's currently in a facility in Dublin called Lois Bridges. It's a private facility, 3,000 a week. Her family, who are also on her parents, David and Suzanne, are moving heaven and earth and raising money and trying to get money to keep her there for at least 12 weeks. But just let's hear Paula's voice from yesterday about how she's getting on. How long have you been in the facility now, Paula?
This will be my 8th week here now.
Okay.
It's going well, like it's only because of how things went in hospital in Galway and stuff. I feel like I was almost playing catch up when I arrived here. The facilities here are just, you can't compare them to Galway at all. Galway just doesn't have anything for eating disorders.
And Paula, how long have you been afflicted by anorexia, by an eating disorder?
Since I was about 12, it's been there. But,
and you're nearly 20 now, isn't that correct?
I'm nearly you're 20, yeah, I'm 19.
Yeah. And so were you in, you mentioned hospital, so you were in the care when you were under 18, is that it? Did that make a difference? You're in the child and adolescence mental health care, CAMS?
Yeah, I had to go inpatient then as well. I was inpatient there for about 10 months. The adult service just can't provide the same help.
That's why you're in the private facility.
Well, I have been suffering for quite a long time, but I think if I had to go home now, I don't really know what would happen. I think I would probably end up in hospital again. And I'm just really scared, to be honest. I don't really know what to do anymore. I'm in a situation now where it's quite scary, and I don't know. It just seems like the HSE isn't listening, and it almost feeds into the illness as if no one cares and that you're not good enough for funding or something.
And as Suzanne said about her daughter Paula, she's the strongest woman she knows, but since the age of 12 she's battled with anorexia. Now she also said, she's full of praise for Lois Bridges, I presume. It's a facility in Howth in Dublin, a private facility, but so far the family have spent over 25,000 of their savings, but I presume are exhausted at this stage to pay for Paula's stay there. Ellen, good afternoon.
Good afternoon, Joe.
How are you, Ellen? You say you were in the same position as Paula. Tell us.
Yeah, well, not the exact same position, but a similar position, yeah. 2 years ago, I attended Lois Bridges to get some specialised treatment for my anorexia as well. And I couldn't afford to go in full time. So they worked with me. They're absolutely amazing. They just want to help you in any way they can. So they devised like a 3-day program for me to do. So I went in as a day patient 3 days a week for 16 weeks. And the help I received there was amazing. Like, it really, really is fantastic.
Which is what Paul has said as well.
Yeah. But, like, it's the only one that I know of in Ireland. And I did a lot of research before I went in because I wanted to make sure I was going somewhere that I knew I would get good help in and that had, like, you know, positive outcomes, like, you know, from people who'd been there before and that. So I did that, but like that, I had to fund it myself, my family. Like, we had to fund most of it. Like, I got some back through my health insurance, but not that much, and I had to dip into my savings as well, like, for that. So Yeah, I completely understand the position that they're in, and it's so frustrating that it's such a difficult time anyway, and then to have to go fight tooth and nail to get funding for it.
Well,
and
that's
support.
what
It's just an
Paula
added
was
burden.
saying there. Yeah. And
Yeah,
is it Lois Bridges or Lois Bridges? There's two different names. What?
I know. I call it Lois Bridges, but
Lois.
I'm not exactly sure.
And where does the name come from? Don't even know.
To be honest, I don't actually know.
Lois
Yeah,
Bridges, okay. But I see it there. It's Ireland's only dedicated residential and daycare patient facility for the treatment of eating disorders, isn't it?
Yeah,
Anorexia, bulimia, and binge eating disorder. And how many people will be there at any one time, insofar as you know?
I think it's 9 inpatient.
Okay.
And then there'd be day patients as well, like that will be coming maybe 2 or 3 days a week, or they might be just coming in to meet with a specialist like a dietitian or a psychologist just for those appointments, after they've done the more intensive treatment. So there could be 11, 12 people in the groups, because they run group sessions there on any one day. Yeah, but I think it's 9 for inpatient.
Yeah.
9 beds.
And there's group therapy, I presume, and family therapy and individual therapy and...
Yeah, and dietitian appointments and
clinic psychologists, psychiatrists, I presume.
Yes, yeah, they have all that, and then they have the group sessions during the day with a psychologist, and just the combination of all those together, like, it really, it's a really...
And
good,
Ellen, what is it like with a group of people together who have anorexia? Is that does that setting work where the way we're advised, for example, when we're talking about anorexia and programs like this, never to refer to weight, never to say, because someone else listening might be saying, oh, hang on a minute, I'm 2 stone heavier than that person, and I want so there can be difficult peer pressure. It's especially with that. How did you find that? Because you're well now, obviously. Am I right?
Yeah. I'm not fully recovered, but I'm definitely way better than I was. Yeah, absolutely. No, it is. It's difficult. It's definitely difficult. It's not easy at all. But there's all the different situations that you're in. But it's run by the group sessions. They all have their own, there's different subjects in each one, and they're run in a very structured way with a topic that you're talking about, and it's a very safe setting. And I found it very beneficial because it just really, really highlights that it is an illness, and we all have similar beliefs, thoughts, patterns, that kind of way. So it kind of gives you that reassurance in that way that it's not you. There's nothing wrong with you. It is an illness. And also being able to talk about your experience and get support from people who just get it. You don't really have to explain yourself too much, because they understand it as well. And then obviously getting the tools and to deal with what you're going through from the psychologist and putting them into practice and stuff. There, it's obviously a difficult process, but its benefits.
It seems to be a nice setting as well, in terms of it's like a big house rather than an institution.
That's it. Yeah, no, that's it. Yeah. So it's much more relaxed. Yeah.
Stay with us, Ellen. Karen Blanche. Karen, good afternoon.
You.
How are you?
Good, thank you.
Okay. Do you know of this facility, or is it just that you suffered from anorexia?
I've never been in this facility. I was in a different facility.
Okay.
And I have spoken to people who have been in Lois Bridges. I know it's amazing. I'm not long after being discharged from St. John of God.
Okay.
I was there for 16 weeks, and like Paula's story yesterday, I was in General Hospital before being admitted to John of God. Right. And the issue with me again was I had no health insurance, so I wasn't able to access private care in a residential treatment centre. So I was 6 weeks in General Hospital, basically sitting in a bed, not being treated, not seeing any psychologists, nobody. And we had to fight, like Paula's parents are trying to do, to get access to treatment. so I could go home eventually. It was really tough.
And how did you get on in that fight to get funding and to get... Because the state treatment is extraordinarily limited, isn't it?
Well, that's just it. I know I was referred to the community mental health team last April, and they sent a letter back to my GP to say that they have no experience with anorexia. Yeah. So that was the support they could offer, which was nothing at all. There was no HSC dietitian in the area either. And just in reference to the 3 public beds the HSC say they have in Vincent's Hospital, you have to be within the Vincent's Hospital catchment area to actually avail of those beds. So it's not like anyone in the country can access those 3 public beds.
But what shocked me about the statement yesterday wasn't from the HSE. It wasn't just that I understand they say we didn't ask them to talk about an individual case as such, but they then said there are facilities available, and the facilities they then went on to detail were the 3 beds in St Vincent's Hospital. That was it.
Yeah,
that's it.
As I said, they're only for people that are living within a certain postcode in Dublin. Not even people who live in... I've heard of people in Tala being outside the catchment area for those 3 beds. So
now they did say there are private facilities which they will consider, but that was Paula's problem yesterday. Paula's challenge rather, and that was that the family are paying privately for this facility.
Barbaric. It's absolutely barbaric to basically say we can't offer you anything, but we're not willing to fund actual treatment for her to recover. It's just disgraceful. It really is so hard. I had to, in the end, I sent a letter from my hospital bed to the HSC, a letter of complaint, and from there it escalated, and I had TDs involved. My husband was sending emails, making phone calls several times a day, and you just have to shout as loud as you can.
And what was your letter of complaint, Karen, from your hospital bed?
My letter of complaint basically outlined the fact that I had been seeking treatment for months. I had been attending my GP. He had referred me to the local mental health team, who said they can't help me.
Okay.
Everything I was funding myself, my own counsellor, my own dietitian. I had become medically unstable, which is why I was in hospital.
Okay.
And I was basically outlining the fact that I'd been there for 6 weeks, receiving no treatment, no support. Like, some days a doctor or a nurse wouldn't even acknowledge the fact that I was there. Like, there was nothing. It was just, and I felt sorry sometimes for the doctors and nurses as well, because they didn't really know what to do with me, to be honest, because they didn't know what to offer me. They were trying to access some sort of eating disorder services, but there is none. So I basically just outlined all of that in my letter. And I am a mother. I've got 2 small children. I wanted to go home and I wanted to be better. And I basically just outlined that all in my letter, and eventually they took notice.
And what happened then? I presume, did you get into
funding? Funding was made available, and I got a space in St John of God.
Okay.
They have an eating disorder program there.
Okay.
So I'm just discharged just before Christmas.
Okay.
So I'm home a few weeks now.
Okay. And how long have you suffered from anorexia, Karen, can I ask?
On and off since I was 17, and I'm 34 now.
Okay.
Well, I will say I've had some very good years between those times. I haven't always been sick, so I know what it is to be well as well.
It's a cruel illness.
It's horrible, it is. I wouldn't wish it on my worst enemy. Yeah.
Stay with us, Karen, if you would. Ellen's still on the line, who suffered from anorexia as well. Anne, good afternoon.
Hello, Joe. How are you?
Yeah, and who are you talking about, Anne?
My daughter, Ella.
Okay,
basically, I have gone everywhere to get her help. She is currently under CAMS at the moment. But before, when she started, she's anorexic now since she was 12 years of age. But I've only got help for her in the last year, but it's through CAMS. But they haven't got the facility for anorexia. They're more mental health. It's just, I'm very nervous. Excuse me now.
Take your time. You're fine.
I'm fighting for my daughter here as well.
Okay.
I just want to highlight the fact that there's so many children across Ireland facing, and parents she struggles with this eating disorder, and there's no help out there in Ireland whatsoever. I have rang, I've emailed everybody to try to get help. Before Christmas.
Yeah, go ahead.
Pardon? I tried to see if I could get her to England because they have the proper facilities in England. They have proper facilities in Canada, anywhere. But Ireland is just, anorexia is not recognised. There isn't the help out there. Like my daughter at the moment, she's been force-fed with a tube, and I'm worried that that's going to cause irreversible damage to her mental health, which it is. But basically, I was fighting for ages to get her help, and when I did get help for her, she was hours away from. They told me she'd another 12 hours at home, and she would have been dead. She wouldn't be here.
God.
So they admitted her into hospital, Crumlin Hospital, and then on the Saturday morning, she got admitted on the Friday. The NG tube put in on the Thursday. She did everything. She didn't want to be fed because she had it in her head she's so fat, and God, there's not a pick on her. Like, her heart rate was so low. She spent 3 weeks in the heart unit. And then they called me and they said another 48 hours, brought me into a room and said she's 48 hours to live. Her organs are going to start shutting down. So they said I had to sign a form for her to be sedated. So she was sedated, and it was 50-50 because it can stop the heart altogether because the heart rate was dangerously low. And then she spent 3 weeks there, and then she was transferred to a CAMS inpatient unit. And she was there for a number of months. I had her home, but the outpatient clinic, like CAMS mental health, is 9 to 5 Monday to Friday. Like for children's mental health or anorexia, anything, there's nothing after them hours. You can't just go to any hospital because they don't have the training for anorexia. It's not like I could walk into any children's hospital with her because they don't know what to do.
Speciality,
and where is it?
So where are we now, Anne? How is she now? And where are you in your campaign, so to speak, to get her proper help?
Basically, she's an inpatient at the moment, but she is being force-fed. Because she's in there a month now. She went back in again on the 27th of December. She didn't gain any weight. They're concerned, so they're force feeding her now with tube feeds to put on weight because she can't gain weight herself. Her periods have stopped again. She only got them back for about 3 months, and then that was it. They've stopped again. Basically, I'm in touch with the founder of Pieta House, Joan Freeman. She's been an absolute rock to me the last few months in trying to get my daughter Ella admitted again because I couldn't do any more for her home, and I was so afraid. I'm watching her literally die in front of my eyes, and I have nowhere to go. And basically, she's an inpatient here, but I can't get her anywhere else unless I can get help. Now, Joan Freeman has offered she is going to try and set up a place for proper treatment in Ireland, but obviously she needs backing.
Specialised treatment, like I presume like Lois Bridges. It is a private.
But Lois Bridges is for adults. See, my daughter's only 15.
Oh yeah, Polly.
There's nowhere else I can go.
Okay. And when you arrived in A&E with her, what was the reaction in A&E?
They rushed her because her heart rate was so low, and they said to me, look, another 12 hours at home and she wouldn't be here. She was so weak, that was about February. In January, I brought her to Children's A&E. They referred me back to the GP. The GP referred me to CAMS. They sat my daughter down. They said, do you want to die? She said, no. Do you have any suicidal thoughts? No. They said, we don't need to see your daughter again. She's not mental health. So I had to ring up every day for 3 weeks, and eventually this doctor agreed to see me with her. He weighed her, did her BMI, and then brought me back 7 days later, weighed her again, did her all, and he said, oh my God, she's dropped 5 pounds, 3 kilos. Her heart rate is dangerously low. She needs to go to hospital straight away. So when I did get her in, I knew she wasn't going to come home for a while, but nothing prepared me for what was ahead. Nothing.
And you're trying to get her to England, I presume, at this stage. Is that to one of those facilities?
That's it, but because she's under CAMS, they're HSE run. So basically, I can't go to the HSE and ask them for funding while she's under them because they won't give me referral letters. Now, they are doing their best, but I just don't agree with this force feeding against her will, everything. It's not working for her. Yeah. It's actually mentally, it's making her worse. They started her on medication to calm her down. They've upped it today. They rang me today. They've upped it. And then, like for example, they force feed my daughter. They put the tube in. And then a half an hour later, they expect her to sit and eat a full dinner today at 1 o'clock. That's not right. That's not possible. I couldn't do it. It's like having a dinner and then a half an hour later, you've got to eat another dinner. You know,
That's why you need that specialised facility, isn't it?
Yeah, and like I feel like anybody that can try and help me, guide me in the right way, because I'm basically fighting for my child's life here. And I just don't know where else to turn. And when I heard the other lady on the radio yesterday, I cried all night because I kept thinking, her daughter's 19. She's like this since she was 12. And she too was in and out of CAMS. Yeah. Like, it's a roller coaster. You're back and forth all the time. And it's like, my daughter's crying, begging me, Mommy, please, please, I just want my life back. And I don't know where else to turn, Joe, and I'm begging somebody to help me here with my child.
Okay. And I know I'm told the HSE visited Paula after yesterday's contact with the programme. And what you're saying, I'm saying it's being replicated, unfortunately. You're not alone, unfortunately.
Like, Joe, my daughter doesn't get counselling or psychology because they're saying that she's too unwell and too underweight, that the brain shrinks when they lose so much weight that she can't think properly. So all she sees is just we're signing forms to get her force fed, and that's not it, because I don't want that. I want the proper help for her, but somebody has to save her life.
Okay, and thanks indeed. And Karen Blanche as well, and Ellen. I know Anna, that's not your real name, but we have all your details. And Ella is not your daughter's name, but we wish you so much goodness. Okay, we'll talk more about this tomorrow. I'm just looking at the screen, but definitely we'll be talking about this tomorrow. 51551.